Over 70% of the blood pressure readings you take at home are outright lying to you. That single inaccurate number could lead your doctor to prescribe heavy medication you don't even need, costing you thousands of dollars. Take my patient John. His home monitor consistently flashed a terrifying 145/90, suggesting severe hypertension. But the culprit wasn't his cardiovascular system, it was a simple law of fluid dynamics playing out in his brachial artery. If you want the real science behind longevity, subscribe. Let's get into it. Your heart acts as a central pump, pushing blood through a closed loop of elastic vessels. To measure this pressure, a home monitor uses an inflatable cuff to temporarily collapse the brachial artery in your upper arm. As the cuff slowly deflates, it detects the exact moment blood begins turbulent flow again, marking your systolic pressure. But when John placed that cuff over his thick fleece sweater, he distorted the physics of the compression. Fabric absorbs a portion of the cuff's expanding force, requiring the machine to inflate to a higher pressure to stop the artery's pulse. This single layer of cotton or fleece can artificially inflate a reading by up to 20 points. Then there is the silent influence of gravity, which exerts hydrostatic pressure on the columns of blood in your limbs. If John let his arm dangle off the edge of the sofa, gravity pulled blood downward, elevating the pressure at the cuff site. For every inch your arm sits below your heart level, the monitor adds roughly 2 millimeters of mercury to your reading. This meant John's posture, not his actual arterial health, was creating that scary 145 reading. Conversely, resting your arm on a kitchen counter that is too high forces the heart to pump against gravity, showing a falsely low number. Another invisible disruptor is the isometric contraction of your arm muscles. If you hold your arm up in the air without support, you activate continuous subtle muscle fibers. This minor exertion compresses microvessels, raising systemic resistance and driving up your diastolic score. Properly resting your forearm flat on a table completely eliminates this muscular interference. Even the size of the cuff's internal bladder plays a massive role in John's reading accuracy. Because John has muscular arms, a standard medium cuff bladder couldn't wrap around 80% of his arm. This mismatch forced the device to overinflate to compress the artery, resulting in a false positive reading. Using a cuff that is too small can easily add 10 points to your systolic measurement. Now consider your autonomic nervous system, which constantly adjusts blood flow based on physical stresses. A full bladder activates the vesicopressor reflex, triggering a sympathetic fight-or-flight response. This reflex constricts blood vessels throughout your body, causing a temporary spike in pressure. Simply forgetting to use the bathroom before your test can skew your data by up to 15 millimeters of mercury. But the most common psychological trigger is what clinical researchers call the white coat response, which occurred every time John pressed the start button. John sits at his desk, hurriedly slides the blood pressure cuff over his thick wool sweater, and hits start. That sweater layer doesn't just muffle the sound, it acts as extra tissue, forcing the cuff to exert higher pressure and inflating the reading by up to 40 mmHg. To prevent this, the cuff must always sit directly on bare skin, but be careful how you get it there. Rolling up a tight sleeve creates a tourniquet effect, constricting the brachial artery and artificially raising your pressure before the machine even starts. Once the sleeve is out of the way, the physical position of the cuff on your upper arm dictates the accuracy of the reading. Position the bottom edge exactly 1 inch above the bend of your elbow to align the sensor with your brachial artery, but correct placement on the arm is useless if the arm itself is sitting at the wrong height. If John lets his arm hang below his heart, gravity adds hydrostatic pressure to the blood column, adding up to 10 points to the reading. Conversely, resting the arm too high on a tall table reduces the pressure head, yielding a falsely low result. Think of your vascular system like a vertical plumbing loop, where height shifts the localized pressure. Next we have to look at how John is sitting, starting with his crossed legs. Crossing legs at the knees compresses lower extremity veins, which increases venous return to the heart and elevates systolic pressure by up to 8 mmHg. Uncross your legs and keep both feet flat on the floor to maintain normal blood distribution. Posture also matters. John is slouching forward instead of leaning back. Slouching requires subtle isometric muscle contraction in your core, which triggers a sympathetic nervous response that narrows blood vessels. To counter this, choose a chair with firm back support and sit quietly for at least 5 minutes before starting. Skipping this quiet rest period is one of the most common errors, as immediate physical activity elevates your heart rate. Even minor movement triggers a temporary spike in cardiac output, distorting your true resting baseline. While waiting, John scrolls through a stressful work email. Another mistake. Mental stress activates the adrenal glands, releasing cortisol and adrenaline that cause immediate temporary arterial stiffness. He also drank a cup of coffee just 20 minutes prior to sitting down. Caffeine blocks adenosine receptors, preventing natural blood vessel dilation and causing acute vasoconstriction. This caffeine-induced constriction can inflate your systolic reading by up to 15 mmHg for up to 2 hours. There is also a physical stressor John is ignoring. His bladder is full. A distended bladder stimulates the sympathetic nervous system, raising blood pressure by 10 to 15 points to help expel fluid. Always empty your bladder before taking a reading to avoid this autonomic reflex. Finally, the environment plays a role, and John's office is kept at a chilly 64 degrees. Cold temperatures trigger peripheral vasoconstriction, shunting blood to the core to protect vital organs and raising overall pressure. Ensure the room is at a comfortable neutral temperature to prevent this vascular defense mechanism. By eliminating these subtle environmental and behavioral traps, John finally gets an accurate measurement of his cardiovascular health. Even if you have rested, the way you sit determines how blood travels through your body. The physical alignment of your limbs directly alters your baseline hemodynamics. Crossing your legs at the knees is a classic mistake. It compresses the large veins in your lower extremities, forcing more blood back towards your chest. Such a sudden surge in venous return forces your heart to pump harder, artificially inflating your systolic pressure by up to 8 points. To avoid this, keep both feet flat on the floor to allow blood to pool naturally in your lower limbs. Slouching or failing to support your back adds isometric muscle tension. Your body interprets this microstrain as physical effort, releasing a trickle of adrenaline. That tiny adrenaline spike constricts your blood vessels, raising your diastolic reading by several points. Next, we must analyze the position of your arm itself. It has to be supported at the exact level of your right atrium. If the arm hangs below heart level, gravity adds hydrostatic pressure to the fluid column. Gravity adds roughly 2 millimeters of mercury for every inch your arm sits below your heart. Conversely, raising the arm too high drops the reading, which masks real hypertension. Keep your arm resting on a table completely relaxed to eliminate any muscle contraction in your biceps. Flexing your arm muscles to hold it up acts like a miniature tourniquet, raising your pressure instantly. Then there is the silent culprit, a full bladder. A distended bladder puts mechanical pressure on your pelvic organs, triggering a reflex in your sympathetic nervous system. This specific fight or flight response constricts blood vessels to redirect blood flow, adding up to 15 points to your systolic reading. Always empty your bladder before sitting down for a reading to avoid this false stress response. Let's look closer at the fabric between your skin and the cuff. Wrapping the cuff over a sleeve, even a thin shirt, disrupts the sensor's ability to detect arterial vibrations. Friction and fabric absorb the subtle sound waves, causing the machine to overinflate to find the pulse. On the other hand, rolling up your sleeve tightly can create a tourniquet effect, restricting blood flow before the cuff even inflates. Apply the cuff directly to bare skin, ensuring it sits about 1 inch above the bend of your elbow. The cuff size itself is another math problem that many people get wrong. Using a bladder that is too small prevents the device from distributing pressure evenly around your brachial artery. Consequently, the monitor applies extra force, resulting in a reading that is artificially high by up to 10 points. A cuff that is too large has the opposite effect, underestimating your true blood pressure. Measure the circumference of your upper arm to choose a cuff that covers at least 80% of the area. Temperature also plays an underappreciated role in your cardiovascular readings. When the room is chilly, your body initiates peripheral vasoconstriction to conserve core heat. Narrowing of the outer blood vessels naturally pushes your overall blood pressure upward. Ensure the room is at a comfortable warm temperature before starting your routine. If your arm is dangled at your side during a reading, gravity pulls blood downward into your limbs, artificially spiking the measurement by up to 10 points. Gravity changes the hydrostatic pressure in your brachial artery, tricking the digital sensor. Your cuff must rest exactly at the level of your right atrium to ensure an accurate reading. A position deviation of just 3 inches below heart level causes the device to overestimate your systolic pressure. Supporting your arm with a pillow prevents this hydrostatic inflation. Even passive listening can alter your readings during the inflation cycle. Hearing someone speak shifts your focus and alters your autonomic nervous tone. During speech, your brain releases small amounts of norepinephrine. This neurotransmitter binds to receptors on smooth muscle cells, causing your blood vessels to constrict. Because vocal activity spikes pressure by 15 points, complete silence is mandatory. To get a true baseline, sit in absolute silence until the monitor displays your final reading. Lower body posture plays a massive role in venous circulation. Crossing your legs at the knees compresses the veins in your lower extremities, restricting venous return. Crossing your knees forces pooled blood back toward your chest. This increases the volume of blood the heart has to pump, spiking systemic pressure throughout your arterial tree. Keeping both feet flat on the floor avoids this artificial pressure bump. This mechanical blockage acts just like stepping on a hose, elevating your systolic reading by nearly 8 points. Your back must rest firmly against the chair's backrest to keep muscles relaxed. Slouching forces your abdominal and back muscles to contract, which raises intra-abdominal pressure and spikes your reading. A full bladder initiates a survival reflex. It signals the sympathetic nervous system to initiate a stress response. The vasopressor response constricts arteries to prevent sudden pressure drops under stress. It is a primitive response designed to keep you alert when your body needs to eliminate waste. Emptying your bladder beforehand eliminates a 15-point systolic inflation. Always empty your bladder completely before sitting down to take a reading. Rushing to start the machine captures your active sympathetic stress level. Beginning the measurement immediately after sitting down fails to reflect your resting homeostasis. 5 minutes of quiet rest helps your nervous system settle. This transition phase allows your heart rate and vascular resistance to reach a true baseline. Checking your phone triggers dopamine and cortisol spikes that skew the baseline. True resting blood pressure can only be measured when your mind is also at rest. Rolling up a tight sleeve creates a constriction point. This makeshift tourniquet alters local hemodynamics before inflation even begins. Restricting venous return causes blood to pool, skewing your numbers by up to 10 points. Always slide your arm completely out of tight garments. Skin-to-cuff contact is essential for accurate arterial tracking. Placing the device over a thick shirt muffles the sound sensors, causing inaccurate pressure readings. Using an improperly sized cuff bladder distributes pressure unevenly. If the inflatable portion is too short, it fails to compress the artery uniformly. Too small a cuff forces the device to overinflate to get a reading. This pneumatic overcompensation leads to a falsely elevated measurement. Wrap a measuring tape around your upper arm to choose the correct cuff size. Most standard cuffs fit a range of 9 to 13 inches, but larger arms need wide cuffs. Cold environments trigger superficial vasoconstriction to preserve your core temperature. This response shifts blood inward, raising systemic arterial pressure. Measuring in a warm room prevents this temperature-induced pressure spike. Keep the room between 70 and 72 degrees Fahrenheit for accurate results. Caffeine blocks adenosine receptors, preventing your blood vessels from dilating naturally. This chemical blockade temporarily spikes your cardiovascular numbers. Avoid consuming coffee, tea, or soda for 30 minutes before testing. This window ensures the stimulants have cleared your blood vessels. Nicotine triggers epinephrine release, spiking heart rate and pressure. This effect is powerful enough to skew your reading for up to an hour. Physical exertion elevates your heart rate and vascular resistance temporarily. This normal physiological spike must settle before you take a baseline reading. A 30-minute rest window after exercise restores normal vascular tone. This delay allows your parasympathetic nervous system to re-establish homeostatic balance. Averaging 2 readings taken 1 minute apart filters out breathing fluctuations and minor anxiety spikes. This combined value provides a much more stable representation of your actual cardiovascular state. Crossing your legs at the knees is the first silent habit that corrupts your data. This physical compression restricts blood flow in the femoral veins, pooling blood in your lower extremities. Your heart must pump harder to overcome this resistance, temporarily elevating your systemic pressure. That simple hemodynamic shift can falsely inflate your systolic reading by up to 8 millimeters of mercury. Keep both feet planted flat on the floor to maintain natural, unrestricted vascular flow. Slouching or leaving your back unsupported in the chair introduces another mechanical error. Without proper back support, your core muscles must contract continuously to keep you upright. This subtle, involuntary muscle tension triggers a mild sympathetic reflex that raises arterial pressure. Sit back completely against the chair to keep your skeletal muscles entirely relaxed. Arm position relative to your heart level is equally critical for hydrostatic balance. If your arm hangs too low, gravity pulls blood downward, forcing the cuff to read higher pressure. This gravitational weight adds a false 10 millimeters of mercury to both numbers. Conversely, holding your arm in the air without support requires muscle activation, which also spikes pressure. Rest your elbow on a table so the cuff aligns perfectly with your right atrium. Let's examine the hidden impact of your bladder volume on these readings. A full bladder acts as a physical stressor, triggering the fight or flight nervous system. Your brain interprets the bladder wall's stretch signals as an active physiological threat. This nervous stimulation releases norepinephrine, constricting blood vessels and raising pressure by 15 points. That artificial spike is often the difference between normal health and a stage 2 hypertension diagnosis. Always use the restroom before you sit down to start your reading. Ambient room temperature also plays a surprising role in your arterial diameter. Cold environments trigger vasoconstriction in your skin to conserve core body heat. This sudden narrowing of the peripheral vessels increases resistance throughout the entire circulatory loop. Aim for a comfortably warm room to prevent this temperature-induced vascular tightening. Speaking or even listening actively during the measurement introduces cognitive interference. Vocal cord vibration and processing spoken words stimulate your sympathetic nerves. This minor cognitive effort can artificially inflate your reading by 10 points. Ensure complete silence, avoiding all conversation and digital screens during the session. Caffeine consumption within 30 minutes of the test directly alters your arterial lining. It blocks adenosine receptors, preventing blood vessels from dilating and causing a temporary pressure spike. Measuring over your sleeve instead of bare skin can artificially add up to 10 points to your systolic reading. That extra fabric mimics the resistance of stiffening, plaque-filled arteries. Crossing your legs at the knee does the same, compressing lower extremity veins and forcing excess blood back toward your heart. This temporary backup creates a false elevated pressure spike. Even speaking or actively listening during the test triggers a sympathetic nervous response. Your body treats conversation as a mild threat, immediately constricting your blood vessels. These tiny daily errors lead millions of Americans to be misdiagnosed with stage 1 hypertension. You could end up on lifelong prescriptions for a condition you don't actually have. To fix this, sit quietly in a chair with back support and feet flat on the floor for 5 full minutes before pressing start. Give your autonomic nervous system time to reach a true baseline. Rest your arm on a flat surface at heart level, aligning the cuff's bladder directly over your brachial artery. A dangling arm forces your heart to pump harder against gravity, inflating the data. Always take 3 consecutive readings spaced 1 minute apart, then completely discard the first result. That initial cuff inflation triggers a startle reflex that skews your starting number. Average the second and third readings to get your true clinical value. This clean metric prevents your doctor from overprescribing based on white coat anxiety. Blood pressure is a constantly shifting wave, not a single permanent number. We are looking for the quiet undercurrent of your vascular system, not the temporary storm. By mastering this simple protocol, you reclaim control over your metabolic health and avoid unnecessary, side effect heavy medications. Accurate data is your best defense against over-medicalization. The payoff is simple: a clear, accurate picture of your actual arterial health, freeing you from unnecessary medical panic. You deserve to know the real state of your heart. If you want to protect your longevity with real science, hit that like button to share this crucial info. Let me know in the comments, do you measure on bare skin or overclothing? Subscribe for more zero-fluff doctor-level breakdowns of metabolic longevity. Next time, we're dissecting the dangerous truth about tracking your heart rate variability.